In the previous module, we looked at how Chiari research has grown over time in terms of the quality of the research studies being performed and where it is still lacking. In this module, we will briefly discuss several of the most active current areas of Chiari research. The first such research area is identifying new Chiari markers and diagnostic tests. Why is this important? Chiari is traditionally defined as herniation of the cerebellar tonsils below the skull of at least 5 millimeters. The problem is that more than 1% of the general population meets this definition. However, only roughly 1 in 1,000 people will ever experience Chiari-related symptoms. Because of this, getting a proper diagnosis can be difficult for Chiari patients. Unfortunately, research has shown that adult patients who are symptomatic for more than 2 years before being diagnosed tend to have worse outcomes than patients who are diagnosed sooner. Conquer Chiari has sponsored a significant amount of research in this area, using imaging to look for additional anatomical markers of Chiari. This research has in fact shown that Chiari patients on average have at least 3 other anatomical markers that are easily identified. However, linking these markers to symptoms has proven elusive. Currently, researchers are focusing on combining these markers with dynamic measurements of the cerebrospinal fluid system. Another approach being investigated is looking at whether inflammatory markers in the bloodstream can provide useful information. A second active area of research is understanding how Chiari affects patients' quality of life. This can be thought of as quantifying the physical, cognitive, and psychological impact of Chiari. Conquer Chiari and others have made significant progress in this regard for the adult patient population, but less progress has been made on the pediatric front. Research has clearly established the extreme physical toll that Chiari has on adults in terms of pain, neck disability, balance issues, and lack of sleep. Recent studies are focused on identifying the specific muscular strength and range of motion deficits that are common in Chiari adults. Meanwhile, research has clearly established that Chiari can affect cognition even beyond the impact of chronic pain. Similarly, studies have shown that Chiari adults suffer from very high levels of depression and anxiety and, unfortunately, are at an elevated risk for self-harm and suicide. The physical, cognitive, and psychological impact on children is not as well understood, largely because research on children is more difficult logistically. While Conquer Chiari is investigating a program to help Chiari patients cope psychologically, to date no physical or cognitive interventions have been tested for either adults or children. A third important research area is understanding the root causes of Chiari, including genetics. While developing a deeper understanding of Chiari may lead to improved and even non-surgical treatments, Chiari is a complex condition. Over the years, several theories of Chiari have been proposed, but none have been proven conclusively and become widely accepted. Recently, Conquer Chiari researchers developed a novel theory of Chiari and are in the early stages of testing it. Genetically, studies have identified variations in Chiari patients, but the picture appears to be complex and likely very expensive to explore fully. Finally, clinical studies still represent an active area of Chiari research. It is now common to see clinical reports on hundreds of patients rather than just a few. These reports provide valuable data for patients and their families as they weigh important decisions. In addition, surgeons will publish variations in the specific techniques used during Chiari surgery in an effort to maximize outcomes and minimize complications. While progress is slowly being made, there are some challenging aspects to Chiari research and research in general that are worth noting. First is the fact that Chiari does not receive much attention or money relative to other conditions. For example, over the last 10 years there have been on average roughly 250 Chiari-related publications per year. Over that same period, multiple sclerosis had over 5,000 publications per year. Similarly, there are currently no active Chiari-focused clinical trials in the U.S., while there are over 250 active MS clinical trials. Another Chiari challenge is the fact that as a group, Chiari patients are extremely heterogeneous or varied. There are pediatric patients, adult patients, surgical patients, non-surgical patients with EDS, patients with syringomyelia, etc. This broad mix of patients can essentially hide interesting results that may only apply to one subgroup of patients. This means that research into a specific topic must make a trade-off between having a narrow subject pool or a broad subject pool, with advantages and disadvantages to each approach. Finally, research in general is expensive and many worthwhile studies are simply not within reach of the Chiari community given the cost. For example, a thorough genetic study would involve thousands of subjects and cost millions of dollars. Even worse, The average cost of developing a new drug is estimated to be over $1 billion. However, this doesn't mean we can't make tremendous progress and improve patients' lives. We can. It just means we need to be smart and realistic about how our precious resources are spent.